So I'm very excited to look at the data from the Mindact trial, and at ASCO this year, they presented the follow-up at 8.7 years. And I think that this is very important and highlights the importance of genomic profiling in our breast cancer patients. As we all know that the Mindact trial was a de-escalation trial, and we were really trying to see if the genomic profile can help us prevent some patients from getting chemotherapy. So what they presented in ASCO 2020 was the 8.7 years follow-up. At 5 years, patients who had a clinical high risk and genomic low risk, the DMFS was 94.8% in patients who did not get chemotherapy versus 95.7% in patients who got chemotherapy, which means a difference of only about 0.9%. That means they both did well, whether we gave them chemotherapy or not, which is great. But we all know that as a lot of these patients who are hormone receptor positive, they will have late recurrences. So very important to follow these patients long-term and see if that data is still robust on longer follow-up. So what they presented at ASCO 2020 was a longer follow-up, and the DMFS for patients who got chemotherapy was 92% versus 89.4% in patients who did not get chemotherapy, which was a difference of only about 2.6%. Which was still very valuable. And what is most important is that there was no significant difference in the overall survival. And it was 95.7% at 8 years in patients who got chemotherapy, and 94.3% in patients who did not get chemotherapy, which was only a difference of 1.4%. Confirming that in patients who are clinical high and genomic low, most of these patients do just as well without chemotherapy. So this is kind of really, really encouraging. And I'm kind of very reassured about the importance of the genomic profiling in these patients. So the patients that I would use it in, the patients exactly what they presented, those who have a high clinical risk, which means that they either have a larger size tumor or lymph node involvement, less than 3 obviously, because that was the entry criteria into the trial. And in these patients, I will use the MAMMAPRINT to help me decide about the role of chemotherapy. And so, yeah, clinical high and genomic low. So if you actually look at the full presentation, which is now available in the ASCO, it shows that most of this benefit of not giving chemotherapy was seen in patients who were above 50 years of age group. And there was no significant benefit in patients who got chemotherapy versus patients who did not get chemotherapy. The final conclusions from the authors are that patients who are less than 50 years of age, even in those who are clinical high and low genomic signal, there has to be a discussion about whether they should get chemotherapy or just ovarian function suppression. And this is not any different than in patients that were enrolled on the TAILORx trial. We've kind of found the same thing, that there was about a 5% difference in patients who were less than 50 years of age. And again, so that has to be a discussion. So at this point, I am not sure that I can say completely that I would use it for my next 30-year-old patient who has a low genomic signal. That would be a discussion. But definitely for patients above 50 years of age, I would definitely use the genomic profiling. Another very important thing to remember is that in the Mindact trial, majority of 2/3 of the patients were high risk because they had lymph node positive disease in about 48% of the patients. So it's a kind of a really a high clinical risk population. So it is very reassuring that even in these patients, genomic profile is very valid. So there are lots of exciting things kind of that I'm looking forward to. One of the late breaking abstracts is about the role of surgery in patients who have stage 4 breast cancer but responding very well to treatment, and we want to see if doing surgery of their primary breast cancer would be of value or not. That has been always a question. A lot of data coming about newer agents in breast cancer, in HER2 positive disease, triple negative breast cancer. So I'm kind of really excited to see what ASCO 2020 brings and how it will change my practice.